Affects about 1 in 6 Americans, anyone ages 18 and up. And this morning, we're taking a look at how AI is adapting the technology for a modern generation. Our Michelle Beck got a tour inside of a local company's research center.
And unfortunately, a lot of times the media is still thinking hearing aids look like this. And you know, all of this is now in here.
A little joke speaks volumes about the state of hearing aids today in an era of intelligence.
Okay, and this is our quality lab.
Dave Fabry has his hearing aids in as he takes us around the offices at Starkey.
So I stream directly from my phone to my devices the way other people might use wireless earbuds these days.
And that's just the beginning, according to the chief hearing health officer.
If I'm wearing my devices and fall, it will send an alert to up to 3 trusted contacts in the form of a text message.
The technology across the industry has gotten smarter and smarter.
That is so intelligent, it's superhuman.
To where Starkey's latest model, launched in October, includes generative AI.
So it's constantly learning.
It's constantly learning. Thinking of the way the brain is taking all of those different inputs, not just hearing, motion, visual, all of that is what the brain is doing, and we want to get closer and closer to that.
The Eden Prairie-based company is tackling a problem hearing aids have long faced. When users tune into a voice, they lose the rest of the world.
From a hearing aid user perspective, all they want to know is my hearing better in noise? Bottom line is 28% improvement in word understanding in noisy environments, the ability to detect and discern a voice of interest in a noisy environment.
To reach this level of intelligence, researchers had to test in different elements, making sure all parts communicate with each other.
So it's the antenna that we saw out there that you're testing in
Exactly,
here.
that's exactly right.
Altogether, it's a product that Dr. Heidi Hill has been trying out at her clinic in Osseo.
Making sounds louder is very easy. That's why there's over-the-counter devices. But appropriately amplifying the right things at the right time for that particular patient in the right way, that's very complex. And AI is making that better and better.
No matter how sophisticated the tech gets, Dr. Hill says what ultimately matters includes user preference and proper fitting.
Through a series of tests, including this one, you'd really check for 2 things: physical fit and good
and acoustic fit and good programming. I describe it as there's no unicorn hearing aid.
But smart sounds great, and manufacturers are sprinting towards it.
This is an arms race to try to take advantage of that improved computational power and more sophisticated processing.
Michelle Beck, KARE 11 News, Eden Prairie.
Sounds pretty cool. So Dr. Hill says a pair is going to average about $6,000, so they're not cheap. That includes getting fitted by an audiologist, and then there's, of course, different tiers of technology that you can choose from. But nonetheless, as long as folks can hear, they'll be happy, I'm sure.